Hi, this is Dr. Dan Hebert, owner at the Duxbury Animal Hospital, and I'm here today showing you another piece of technology here within our surgery suite. This is our surgical laser. We use this laser on just about every procedure that we do here, and we use it in place of a scalpel blade. And like everything, people have questions. What's so bad about scalpel blades? Why would we need this technology versus a scalpel blade? Well, scalpel blades are basically small, sharp knives. It cuts through, cuts blood vessels, creates a lot of bleeding. That bleeding needs to be stopped. We have to make sure that that's under control. Despite our best efforts, there's still a lot of swelling because of that bleeding after the surgery, so it takes a lot longer for the incisions to heal. It's also a lot more painful for the patients in the long run. What the laser does is it actually sends out a small, invisible but very powerful laser, and that cuts through the tissue the same way that the scalpel blades did. The big difference is by this laser going through with heat, it cauterizes the blood vessels as it goes, and it tends to shrink up the tissue around it. So we don't have the swelling, we don't have the bleeding, healing is much faster, and during the procedures with all that extra time, it's going to save on anesthesia as well for safety. So there's multiple tips that we use depending on the procedure. We do have this adjustable tip, and that can change the width of the beam. So reason why that's important is when we want to just cut through the skin, we want a very narrow beam, so we're cutting. When we start getting to the deeper tissue, there's a lot more blood vessels, things that need to be sealed up. So we can widen that beam, and it'll actually shrink up those vessels as it's cutting. It's a slower cut, but it prevents all that bleeding and swelling afterwards. We also have some fixed instruments as well. We have these single fixed hand pieces that can go in, and we can put different attachments on them. So this is a very wide beam. It's very flat. We can go through, and so we can use this. If there's a bunch of surface bleeding, we can use that to cauterize the area. If there's small masses that there's really no need to cut, where we can actually just kind of burn them down like a wart, we can use this as well on that. We have these angled pieces, so we can put tips in here. So if we get inside the mouth, we can then get in there at angles. If there's a mass inside on the tongue, on the gums, anything like that, we can use this inside the ears. It works great. We used to have these back stops. So what this does is this screws in on the end, and say things in the back of the throat that we need to cut out, but we don't want to damage tissue in the back of the throat or inside the belly or something like that. We can then put this hook around it and then use the laser, and it'll cut through without damaging the tissue behind it, so it's much safer. So we will demonstrate on the ever versatile chicken, as we always do. Safety first with our goggles, and let's check this out. So we've got chicken skin over chicken. No different than skin over muscle on one of our patients. So we don't touch anything. We're actually floating right over the skin. And then when we activate it with the foot pedal, it cuts right through the skin and doesn't damage any of the tissue underneath. So you can see that the muscle is actually safe underneath. If we want to ablate things on the surface, like a mass, like I said, we can change this to a much wider beam. And you can see here, instead of cutting, it just kind of shrinks the surface. So if we have a little skin mass or something, we can sit there and just cook it off without having to actually cut through anything. And I said, depending on the attachments that we put in, we can do a lot of other different things with this as well. So as you can see, the surgical laser is a very versatile piece of equipment. It allows our doctors to do a lot of specialty procedures that we would normally have to refer clients out to the referral hospitals to have performed. Even the smaller procedures, the less healing time and the less pain that's involved for the patients is obviously much, much better for you guys at home. And it also makes our procedures a lot more easily done. We don't have the bleeding and other complications even during the surgeries that we did with scalpel blades. If you have any other questions about this or just want to chat, please give us a call at 781-934-5300. If you're interested in some of the other equipment in our surgery suite, please check out the other videos on our website. Thank you very much.